And where are you from?
I'm from Madison, Wisconsin.
Oh, well, I even read that in the beginning. I must be losing it. Was that a senior moment or something? Yeah, is this miracle too good for that? Okay, go ahead. Other things that maybe you've noticed. I know once you get rolling, you remember other things.
I guess I am most impressed with what it has done for fibromyalgia, for pain. I'm thinking of one of my patients when I saw her for the first time. I think it was just about the time that I first discovered Miracle 2. She cried when she told me how much pain she was in. And she tried the Miracle, and 2 weeks later she called me and ordered a gallon of it. Because from the very first, she took the bath. Like my daughter, took 7 drops, and it helped her. This woman got into a bath with the neutralizer and the soap, and was so much helped, by her first bath. So for me, it's fibromyalgia has been one of those really difficult conditions to treat.
I know that's
really a hard thing.
That's what I hear too. Now, have you had your patients use the gel?
I have recommended gel. The way I tell people to use it is if they have troublesome spots. So, like arthritis or painful muscles. This woman that I was talking about with the bad pain, who cut her medication in half in the last 2 months, she has been using the gel, and she says it works. It definitely lessens the pain, but it doesn't stay away. She has to keep reapplying it. But I'm thinking, because she's able to cut her meds in half, and overall she has less pain than she did before, and she's able to do more things, that it's not like like some of these drugs that they can get rid of the symptoms, but once the drug wears off, you're right back where you started. The effect of the gel does wear off, and the pain comes back. But I think the baseline is always a little bit better. The baseline of her pain is getting better, because obviously she's cutting back on her pain meds.
Yeah, and then we don't heal, instantly like that. She's
Right.
been that way for a long time, so at
Right.
least it's natural, and she's not getting more medication that gives you other side effects, right?
Yeah, she's cutting back. I mean, she's not been able to do that, so up until using the Miracle.
That's wonderful.
One thing that really is a curious thing to me is when I heard about bath water turning black, because I was, so I jumped in the tub and I'm waiting for it to turn black, and it didn't turn black for me at all. But one of my patients who has very bad skin problems, I recommended that he use the bath, and he called me about maybe a week or so, maybe a week and a half later, and he said, I don't like this soap. It doesn't get me clean. And I said, what are you talking about? He said, when I take a bath with this and then I dry off, my towel is all black. It's not getting me clean.
Wow.
So that happened for the first couple of times. He was, he was getting the detox and didn't really realize what was happening, I think. And after a couple of baths, it stopped. So apparently whatever had pulled out of his system, it was done, and now it's not happening anymore.
But that's scary. To wipe off
so.
and have black come off.
Yeah, I mean, if you don't know what's happening.
Right, that's why I think it's important everyone knows a lot of these different things, like you're saying, so they can share that with people when they're, selling them the product or introducing it to them, so they don't, get afraid and say, oh, I got to stop doing this.
Yeah. To me, it means it's a very powerful detox. Anything that can pull stuff out of your body, is pretty powerful, and I just think it's a wonderful thing to be able to detox so easily. Taking a bath. I mean, it's amazing. It's just truly amazing.
It is. We just have to make sure we don't make it harder, right?
I think there's always hope. I would never take away somebody's hope. When I recommend the Miracle stuff, what I usually say is, I don't know what this is going to do for you. This has helped a lot of people with a lot of different conditions. So, I would recommend try it. It's so affordable, and it'll work or it won't work. But if you don't try it, you'll never know.
Well, now, Dr. Herbridge, should now in his condition, do you feel it would be too much to drink it and take the bath?
I'm not an expert. Keep in mind, I've only been using this myself for 3 months. But I think that 7 drops ought to be safe. And what I tell my patients is start with 7 drops, see what it does. You know, if it's too much detox too soon, then, you know, skip a day or do less than 7 drops. If you're not getting a bad reaction, then go up. And with cancer patients, I think it's better to go up quicker, especially if you don't feel like you have a lot of time left. Now, one thing that I learned from Dr. Mantell is that for somebody who's been on chemo recently, that if after you take a bath with the soap and the neutralizer, it's very important to rinse the soap off your skin. So you take a bath and then follow that with a shower so that you get the soap off. Otherwise, what happens is it continues to pull the toxins out, and it will pull the chemotherapy out through the skin and cause a burning reaction.
Oh, thank you for telling us that. That's very interesting. Okay, let's see. What other questions with that? So, you know, like one of my main thing is you have an individual that's very ill, and let's say on their deathbed, and so you know that they're taking a lot of medication, and we all know what happens when you start detoxing, and I myself wonder, you know, will this be too much for them? You know, I mean, it's almost like...
I guess if someone had a chronic disease like fibromyalgia, which is chronic but not fatal, then I think you go slow because it's not fatal. You've got time. You know, so you start slow. You start with a few drops and you work up as much as you need in whatever time frame your body is going to let you do. But when you have a terminal cancer, you don't have the luxury of time, you know, and so I don't know what the answer is, but I'm thinking if it were me and I wanted to live, I would work up as quickly as I could. And if it gives you some side effects, so if you get headache or flu-like symptoms or, you know, whatever side effects, in a sense, so what if it's going to save your life?
And should they drink a lot of water?
Oh, definitely. Yeah. Unless, I mean, if somebody has bad kidneys, you know, if you're in kidney failure, you have to be careful about how much water you take. You don't want to overwhelm your system. But if the kidneys are working right and can, you know, water in has to equal water out. Otherwise, it's not a good idea to drink a lot. But for most people, yes, water is very beneficial. I always tell my patients to put the neutralizer in water. I know Clayton says it can be in juice or milk or whatever, but I think most people don't drink enough water, so that's one way you can get more water in your system, is put the neutralizer in water.
Well, you know, some people drink it straight, okay, nothing but neutralizer. What do you think of that?
I don't know. I all the instructions that I've ever read said to mix it with water, so I don't know.
Okay.
What do you think? What do you think of that?
Well, I know my husband does that, and it's okay. I mean, he hasn't noticed anything.
Yeah, I don't know why it should be harmful.
Well, you know, I was also thinking, you know, when someone uses nitroglycerin, you know how they put it under their tongue?
For faster absorption, right?
Yeah, for faster absorption. So then if someone did that with the neutralizer, would that also be faster?
Well, yeah, it might. This neutralizer is such an amazing product. I don't know if it acts like normal things. You know? I would expect you would think it would get absorbed, but I don't know.
Well, I was wondering if you know, under the tongue, you know, is it the pill that causes it to be absorbed that way, or anything that is under the tongue will get absorbed quickly? That's what I
would say anything that's under the tongue. Right. Right.
Oh, you know, that's scary. That's kind of scary when we're using those toothpaste out there.
Red M&Ms.
Yeah. You know, all of that kind of stuff, and we're getting it straight into our bloodstream.
Yeah. Well, the thing is, when you take it by your stomach, when you swallow it, then it has to go through the liver. It gets absorbed into the intestine.